Hospitals today face more challenges than simply caring for patients. Staff shortages, increased targets, and expectations to do more with less budget. But the number one priority for hospitals is still to provide the best level of care for patients. Although most patients admitted to hospital require immediate treatment, the most time-critical condition is myocardial infarction. Cardiovascular diseases remain one of the most important causes of death.
Wat er namelijk gebeurt ten tijde van een hartinfarct is...
What happens during a heart infarction is that a blood clot blocks one of the coronary branches. Normally, the heart muscle is provided with blood through the coronary branch, which mortifies. That's why it is so important to dissolve or remove the blood clot as soon as possible, so the blood can flow again and the infarction will end. Hospitals are faced with the challenge of reducing the crucial time period from when the patient enters the hospital until the reperfusion of the blocked coronary artery is obtained, also known as the door-to-balloon time. Today, this patient journey is tracked using handwritten notes from personnel in contact with the patient. This is a process that faces a number of challenges, including missing and inaccurate data, time-consuming collation and analysis of collected data, and most importantly, a lack of real-time information for staff caring for the patient. Based in the Netherlands, the Leiden University Medical Centre wanted a solution to give staff visibility of the patient's journey in real time and increase staff awareness and motivation. The hospital used Zebra technologies to provide a time-tracking solution capable of accurately tracking the patient journey from the time the patient arrives at the hospital to the moment the balloon process is completed. Supplied by Zebra Technologies, the solution is made up of Bluetooth wristbands, strategically placed tablet devices, and Zebra's Internet of Things service, Zatar. The wristbands are configured to provide a digital voice for the patients, with the information displayed on tablets, which are connected to the internet and act as both displays and readers.
En al die tablets zijn verbonden via een internetverbinding.
All the tablets are connected by an internet connection, either through a wireless network at the hospital or via a 4G connection with our cloud service, Zatar, where they can send all information they detect to, or where they can find information they need in order to give feedback.
De informatie die zij nodig hebben om de feedback te kunnen geven vandaan halen.
At the start of the process in the ambulance, after the patient has been diagnosed for percutaneous coronary intervention, or PCI, the wristband is applied to the patient's wrist. The wristband is immediately active and self-provisioned, and once the patient arrives at the door of the hospital, the door time is registered by the tablet devices at the hospital entrance. Arriving at hospital, a patient needs to get to the catheterization lab as soon as possible. Some patients are first taken to the coronary care unit or emergency department in case they need to be stabilised or if the diagnosis is unclear. But in most cases, patients are moved directly to the catheterization lab. During this time, wearing the Bluetooth wristband, the patient passes a number of wall-mounted tablets that accurately track and provide the journey time to staff, allowing them to focus on primary care for the patient and bringing the patient to the catheterization lab as quickly as possible. As well as recording signals from the Bluetooth wristband and logging the duration of the patient's journey, the tablets have an easy-to-use, configurable colour coding system. These colours can be based on the hospital's own time targets and show doctors and nurses how long a patient has been in treatment. For example, the tablets could flash green if the time passed is under 15 minutes, turn orange between 15 and 30 minutes, and switch to red when the time reaches over 30 minutes. The solution also includes Bluetooth buttons, which allow the physician to accurately indicate the exact time of needle, as well as the exact balloon time when reperfusion of the coronary arteries is restored. After arrival in the catheterization lab, the wristband can be removed and the number is registered in the patient file. The wristband is then placed into a collection box and the patient is taken to recovery.
Zo de positieve effecten.
The positive effects from the system that we are using now is that the patients will be treated as soon as possible. At least that is what we hope. And that there will now be competition between the different teams because staff can now see how long treatment took you. The Zebra Technologies time tracking solution includes a dashboard and a data export function for further analysis and evaluation, to identify delays and optimize the patient logistics. Data can be exported to the electronic patient file system and no protected health information is handled. Using Zebra Technologies' time tracking solution, the Leiden University Medical Centre now have an accurate system for measuring the door-to-balloon time. It allows them to focus on the patient, while receiving the visibility needed to measure performance and optimise the door-to-balloon process. And by utilising the time tracking solution, the data captured is more complete and consistent than ever before. According to the staff at LUMC, Zebra's innovative solution for time registration can be used in multiple hospital departments, where time to treatment is of the utmost importance.